tenfold, and less life-threatening diseases such as ulcers, gallbladder disease, psoriasis, tooth loss, cataracts, macular degeneration, and erectile dysfunction. I put it as less life-threatening, but I know people who consider this life-threatening, yung erectile dysfunction. No? If we just choose the 4 main ones.
Sorry, on the lighter side, kaya kwento ko yan sa male-dominated Senate namin, including yung penile cancer.
Yes.
Kasi, no, because this is a fact. When,
cancer,
what was, I forget the issue, but, whether it was reproductive health or domestic violence, which normally is targeted towards women, di ba? In the early days, no, not now, not so much now. In the early days, parang it's taken very lightly kasi the victims are women, di ba? And I would say, seryoso, pag pinag-usapan natin yung sakit na ang apektado lalaki, tatawa-tawa pa rin kayo. Hindi ito pagtatawanan because just like in medicine, there are studies that show that many of the tests are done on men. And you don't do enough on women, so you don't have that data relevant to women. So ganun din to. So sasabihin ko sa kanila yon. Kaya tatandaan ko yan, yung penile cancer and yung erectile dysfunction.
1.8 is an 80% increase in penile cancer. So nearly double the risk. No? So if now we count lung cancer and then dito ischemic heart disease and stroke and COPD, just 4 of these more than 40 diseases that can be caused by tobacco. What we did in 2012 was try to find out how many deaths from lung cancer and cases will be caused by tobacco. COPD, ischemic heart disease, and ischemic stroke. No? We estimate this from the relative risks I showed. And then we costed it. No? Magkano bang alagaan sila, healthcare, lost productivity because of illness, and premature death. These are losses, economic losses. And if we add all these losses for lung cancers, it's 7 billion in 2012, 27 billion for chronic obstructive lung disease, 77 billion for ischemic heart disease, and for ischemic stroke, also 77 billion. A total of 188.8 billion per year in 2012. So this is in the Senate and Congress presentations in 2012. Now we said then that this is a gross underestimate for 10 reasons. Because the disease incidence we used as basis was the National Health Statistics, and we know it underreports cases. We assumed static prevalence of coronary, cardiovascular disease, and cancer when in fact it was increasing. We used minimum wage to estimate economic loss, and we assumed that only 30% of those age 60 or more were employed. We ignored many things: passive smoking, effect in younger people, adults, effect in pregnant women, and effect on 45 other diseases. We quantified health expenses using PhilHealth, which we know pays very little for our healthcare, and assumed static life expectancy when in fact it was increasing. May number 11 na po today. That was in 2012. No? So if you do adjustments for inflation, this is worth now 388 billion in losses in 2023. Just from these 4 diseases. No? There are alternative estimates. If you estimate disability adjusted life years from tobacco-related diseases, it was from the global burden of disease. This is equivalent to about 2.8 million deaths, except not in the way we look at deaths, where you're either alive or dead. Disability adjusted life year means some people are half dead. Some people are, if you're bedridden and comatose, you're 90% dead. If you sum them all up, it's about loss of 2.8 million lives. And based on that, per GDP per capita in that year, that's about 176,000 per year. The total cost of disability would be 176,000 times 2.8 million, which is about losses of 500 billion pesos from disability. Yung direct cost naman of taking care of these sick people is about 50% of the disability losses, so mga 250 billion. So the total healthcare cost from all the diseases would be 750 billion in 2021 per year. Wag na natin gamitin yung 750 billion, yun na lang 400 billion from 4 diseases. How does this compare with what we earn from tobacco tax revenue? The tobacco tax revenue in 2023 was a measly 135 billion. At laking-laki na tayo rito. It barely pays for the expenses we incur from tobacco. At sino ang nagpapasan ng kaibahang ito? I mentioned it. Sino nagpapasan ng difference na yan? Yung taong bayan. No? Kasi zinero na nga yung budget for PhilHealth this year. So sigurado tayo ang magpapasan ng difference na yan yung taong bayan. So we feel in terms of economic burden, ba't ba tayo nag-uusap about trying to increase sin tax revenues by reducing the excise tax, rolling back, putting a moratorium on excise taxes, di ba? We are nowhere near the balance, no? Our executives are saying, let's achieve a balance between health and revenue. We are so far from that. And we're so far from that we shouldn't even be talking about reducing or putting a moratorium on excise taxes. So our next presenter will be Mr. AJ Montesa.
I mean, it's suspension, no?
Yes.
Thank you for that, Dr. Dan.
Yes. Thank you.
Okay, ready to resume, no? Thank you, Dr. Tony Dance. I appreciate that presentation, and I know a lot of your colleagues have similar data also. So since I think there are about 5 of you, so that I can also see the point of view going to that I assume DOF and BIR will present, no? Because I somehow, obviously, I know the positions of the healthcare advocates. I want to hear this so that they can also then listen, and I think we can have a it's not a big deal, but I just think that flow would be good for all of us. So let me call on we have DOF, BIR, and BOC. So for DOF, it's ASEC Carlo Adriano. ASEC, and then after that, please be ready, Director Galera. There you are. After. Okay, thank you.
Good afternoon, Madam Chair.
Good afternoon.
The DOF agrees with the Chair that there should be a whole of government approach when it comes to the public health. And the DOF has always been an advocate for health with our work with the Chair on sin tax laws and collecting revenues and earmarking it for universal health care. Now, on the other hand, the reduction in collection is significant concern for us, particularly for tobacco. And the DOF is actively finding ways to strengthen and support the BIR and the BOC's enforcement and administrative initiatives to fight illicit trade. The DOF supports any measure to help combat illicit trade, especially of our excisable products. And the DOF is willing to listen to the proposals of our legislators in Congress, of stakeholders and health advocates to achieve greater revenue and, more importantly, to achieve better health outcomes.
That's quite well said, ASEC Carlo. May I know what your background is? Is it finance? Are you a lawyer? Are you a public speaker?
I'm an economist, Madam
You're
Chair.
an economist. Okay. What is your department under DOF?
the fiscal policy monitoring group.
Fiscal
Madam